So my name is Abraham Chachoua. I am the J. and Isabel Fine Professor of Medicine at the NYU Langone Medical Center. I am a member of the Perlmutter Cancer Center of NYU, and I treat patients with lung cancer. There are many different kinds of lung cancer that we need to know about. We used to talk about two main groups, small cell and non-small cell. And the reason for this classification is that these tumor types behave differently. They arise from different cell types, and the thinking was that you treat all non-small cell the same way and you treat small cell a different way. This has evolved through the years, where it's now very important for us as oncologists to know what are the different subtypes of non-small cell. There are several subgroups. The dominant one is something called adenocarcinoma, which means that it came from a glandular organ, and the lung is a glandular organ, and that is based on how the appearance under the microscope is. The second commonest type is squamous carcinoma, and that is a different cell. How I treat an adenocarcinoma now is different from how I would treat a squamous carcinoma. There are some other subtypes that are a little bit less common. Maybe about 5% of lung cancers can be mixed type, and usually what you would see squamous with adenocarcinoma, or you would see maybe some small cell with the other types, but that's not the commonest manifestation of lung cancer. 80% of lung cancers are non-small cell. 20% is small cell. The treatments are very different for both. Is there one more treatable than the other? And I get this question very frequently from patients. The answer is the treatments are different. If I have a patient with a non-small cell lung cancer, whichever the variety, the first question in my mind is, can that person be cured by surgery? Whereas if you have a small cell lung cancer, surgery doesn't play as much of a dominant role. Small cell cancer can be sensitive to chemotherapy, but can also become very resistant to chemotherapy and radiation therapy for that matter. Non-small cell is a bit more resistant to chemotherapy, but again, it does respond. So the bottom line is they are all treatable, but the treatment modalities are very different from one to the next. Most of the advances we've made in lung cancer today have been in non-small cell.